My name is Jason Schultz, and this is my presentation on the drug Versed. Versed is a benzodiazepine that is also known by the brand name Midazolam. Benzodiazepines were discovered in 1954 by an Austrian chemist named Dr. Leo Sternbach and were first introduced to the market in 1960. Currently, there are more than 3 dozen benzodiazepine derivatives available on the U.S. market. When compared to barbiturates, benzodiazepines are significantly less addicting, have a greater margin of safety for overdose, are accompanied by a specific reversal agent, and produce fewer drug interactions. It's for these reasons that benzos have replaced barbiturates as the mainstay for preoperative and intraoperative anxiolysis and sedation. When Versed was developed in 1976 by Fryer and Walser, it was the first benzodiazepine developed with anesthesia as its target group. Over the years, Versed has established itself as the most commonly administered benzodiazepine for preoperative sedation, as well as the most widely used drug in all of anesthesia. Its chemical structure is slightly different than other benzodiazepines, with the addition of the imidazole ring, which makes it stable in an aqueous solution. This is significant because it speeds the rate at which it reaches physiologic pH of blood, closing the imidazole ring. This closure of the ring gives Versed its very high lipid solubility and a rapid onset of action. The most common indications for the use of benzodiazepines are preoperative anxiolysis, sedation and hypnosis for balanced anesthesia, or for the intubated ICU patient. They can also provide some spinal cord mediated skeletal muscle relaxation and anterograde amnesia to prevent recall during surgeries and procedures. It's important to understand that the skeletal muscle relaxation provided by these drugs is not adequate for surgical procedures, and muscle relaxants should still be used. The amnesia caused by benzodiazepines will outlast their sedation, and it's important to understand that just because a patient no longer appears sedated, they may still not remember the events that take place. Benzodiazepines can also be used as a second-line anticonvulsant therapy medication as a result of their ability to increase the seizure threshold. This is a list of some other indications for benzodiazepines that are not typically associated with their use during anesthesia, and I'll allow you to read through these on your own. All of the previously discussed indications for benzodiazepines apply to Versed. However, there are some anesthesia-specific indications that apply only to Versed. There was a meta-analysis done by Grant et al. That showed a subhypnotic dose of Versed is capable of reducing postoperative nausea and vomiting, and can also be used as a rescue drug postoperatively. It can also be used as a rescue drug for the treatment of paradoxical vocal cord motion, and to treat or prevent ketamine-induced post-op delirium. Benzodiazepines like Versed produce their pharmacologic effects by acting as agonists of the inhibitory gamma-amino butyric acid receptor, also known as GABA. They do not activate the GABA receptors directly, but instead bind to the GABA-A receptor, which prompts a modification of the GABA receptor, increasing its affinity for its neurotransmitter GABA. This leads to an increase in the frequency of chloride channel opening, which causes hyperpolarization of the neuron, leading to inhibition of the propagation of a postsynaptic action potential. These actions are related to the effects of benzodiazepines on the alpha subunits of the GABA-A receptor. The sedative effects are related to the activation of the alpha-1 subunit due to their abundance in the cerebral cortex, the cerebellar cortex, and the thalamus. The anxiolytic effects are related to the alpha-2 subunits, which are located mostly in the hippocampus and the amygdala. Versed can be administered via many routes, including intravenous, intramuscular, oral tablet, oral syrup, or even intranasally. The intranasal route is rarely used due to the burning related with its low pH. The IV and PO pharmacokinetics are shown here. The IV onset is 3 to 5 minutes with the same peak plasma level which is much quicker than the PO route, which takes 10 to 20 minutes for onset and 15 to 30 minutes for peak levels. Despite these differences, the duration of action for the two routes are actually the same at 15 to 80 minutes. The IV solution is available in 2 and 5 milliliter vials, most commonly at the concentration of 1 milligram per milliliter. It's also available at a more concentrated 5 milligram per milliliter vial. Due to the fact that Versed is packaged as an aqueous solution, no solvent is required in the medication, which causes less burning with administration compared to other benzodiazepines. This slide contains the common adult dosages used by anesthetists. The dose for preoperative anxiolysis is 1 to 2.5 milligrams IV, 20 minutes prior to induction. Additional doses can be administered after at least a 2-minute waiting period to assess sedation from the previous dose. A dose of greater than 5 milligrams really shouldn't be used. The IM dose for preoperative anxiolysis is 0.07 to 0.08 milligrams per kilogram, 30 to 60 minutes prior to induction of anesthesia with the same 5 milligram cap as IV. The dose required for the induction of anesthesia is 0.1 to 0.2 milligrams per kilogram IV, given over 30 to 60 seconds with a maintenance rate of 0.05 milligrams per kilogram IV as needed, or an infusion at a rate of 0.015 milligrams per kilogram per hour. Use of Versed for the induction of anesthesia is rare, given the large dose required and the availability of better suited drugs for the induction of anesthesia. The dose for prevention of postoperative nausea and vomiting is 2 milligrams IV, 30 minutes prior to the end of surgery or of the procedure that you're doing. If the postoperative sedation is required, a loading dose of 0.5 to 1 milligrams per kilogram IV is used, followed by an infusion of 1 to 7 milligrams per hour via IV infusion. In the event of a paradoxical vocal cord movement, 0.5 to 1 milligrams of IV Versed can be used as a rescue drug. And although it's not a first-line treatment, 0.2 milligrams per kilogram IM may be used for the treatment of status epilepticus, up to a maximum of 10 milligrams. When Versed is used for elderly patients, the dosage should be individualized based on age, comorbidities, and the other medications the patients are taking. 20 to 50% reduction in dose is generally advised in the elderly, the chronically ill, debilitated, or patients receiving other opiates or CNS depressants. There's little information available for non-intubated infants, therefore there are no dosing recommendations available for children less than 6 months of age. This population is at higher risk for airway obstruction and hypoventilation, so titration of small dosages should be used. The recommended dosage for pediatric patients requiring treatment for anxiolysis are 0.05 to 0.1 milligrams per kilogram IV for a patient 6 months to 5 years of age. For children 6 to 12 years of age, the dose is 0.025 to 0.05 milligrams per kilogram IV. Otherwise, you can use an IM dose 30 minutes prior to surgery of 0.1 to 0.15 milligrams per kilogram. For sedation, 0.25 milligrams per kilogram of PO syrup is suggested. For post-operative sedation, you can administer 0.05 to 0.2 milligrams per kilogram as an IV loading dose, and then follow it with a 0.06 to 0.12 milligram per kilogram per hour infusion. Versed can also be used for refractory status epilepticus in pediatric patients at a dose of 0.2 milligrams per kilogram IV every 10 to 15 minutes with a maximum dose of 6 milligrams. The only absolute contraindication to benzodiazepines is a hypersensitivity to the drug itself. The CNS depression caused by benzodiazepines can cause respiratory depression along with depression of the swallowing reflexes and upper airway reactivity. These effects can lead to increases in PaCO2 due to a decrease in tidal volumes. These effects are exacerbated in patients with existing muscle weakness or pulmonary diseases like myasthenia gravis, obstructive sleep apnea, bronchitis, and COPD. Side effects from benzodiazepines are most commonly mild and include things like fatigue, drowsiness, dizziness, lack of coordination, and disinhibition. Some other drugs like inhaled anesthetics, CNS depressants, barbiturates, etomidate, propofol, neurosteroids, and alcohol also act on the GABA-A receptor, which can lead to a synergistic effect, leading to increased inhibition of the central nervous system. Some other CNS depressants that may cause additive effects are antihistamines, antihypertensives, and tricyclic antidepressant agents. These synergistic effects can be advantageous when they're used as adjuvants in anesthesia practice to decrease MAC requirements of inhaled anesthetics, but can also have serious consequences if they're not expected or anticipated. Benzodiazepines may also cause suppression of the hypothalamic pituitary adrenal axis. Suppression of the HPA axis can cause low cortisol levels in patients treated with benzodiazepines. Physical dependence is also possible. It generally takes more than 6 months of use of benzodiazepines for the patient to suffer withdrawal symptoms with decreased or discontinued treatment. They may also inhibit platelets by causing conformational changes in the platelet membrane. It's unclear if this inhibition of platelet aggregation has any significance in the surgical arena. While the side effects of Versed are essentially the same as the other benzodiazepines, there are some unique effects on the central nervous system and the cardiovascular system. The effects of Versed on the CNS can lead to a decrease in cerebral metabolic oxygen requirements and a decrease in cerebral blood flow, which makes it safe for patients that have intracranial pathology. It's important to understand that giving Versed does not prevent increases of intracranial pressure that are associated with laryngoscopy and intubation. The cardiovascular effects are dose dependent, and when Versed is given at moderate to low doses, it causes little to no change in the heart rate or blood pressure. Although the use of midazolam as a sole induction agent is rare due to the high doses and the prolonged duration of action, when it is used at high doses like this, it can lead to a decrease in blood pressure, an increased heart rate, with no net change in cardiac output. The decreased blood pressure is likely related to a decrease in systemic vascular resistance, which could be beneficial in the treatment of patients with conditions like congestive heart failure. The administration of benzodiazepines to the following special populations require consideration. When given to people with personality disorders or intellectual disabilities, paradoxical reactions can occur and be difficult to diagnose. Benzodiazepines will cross the placental barrier, which can cause depression of neonatal vital functions and can lead to a condition called floppy infant syndrome. This syndrome is seen in newborns, and the symptoms include hypotonia, hypothermia, lethargy, and problems with breathing and feeding. Versed can also be detected in breast milk and may exert depressant effects on the nursing infant. Elderly patients have a higher sensitivity to benzodiazepines, so lower doses are required for clinical effects in the aging population. Use of benzodiazepines in the elderly may lead to gait instability, falls, and bone fractures. Conditions like hepatic cirrhosis or chronic renal failure may lead to increases in unbound benzodiazepines in the blood, which can result in enhanced clinical effects due to the fact that benzodiazepines are highly lipid soluble and protein bound, so dosing should be changed accordingly. One of the important advantages to benzodiazepines is that there's a specific reversal agent for overdose. A drug called flumazenil is a competitive antagonist that prevents or reverses the effects of benzodiazepines. The dosing is not weight-based. The initial dose is 0.2 milligrams IV, and you should see reversal of the CNS depressant effects of benzodiazepines within 2 minutes. If a reversal is not seen, additional doses of 0.1 milligrams IV every minute are indicated until you reach reversal. If a dose greater than 5 milligrams is required, other drugs are typically involved. The duration of action of flumazenil is 30 to 60 minutes. Therefore, a low dose infusion of 0.1 to 0.4 milligrams per hour might be required for the reversal of a long-acting benzodiazepine that will outlast the flumazenil. When using flumazenil for respiratory depression related to benzo and opioid use, it's important to understand that flumazenil will only reverse the benzodiazepine component of the respiratory depression, but not the opioid aspect. The administration of flumazenil for patients using anti-epileptic drugs for seizure control is not recommended due to the risk of withdrawal symptoms. After administration of flumazenil, there's a possibility of acute anxiety, hypertension, tachycardia, or an endocrine stress response due to the antagonism of the benzodiazepines. In anesthesia, it's important to understand that flumazenil has no effect on the MAC requirements for volatile anesthetics. Versed is a tremendous drug with a vast array of uses and a relatively small amount of side effects. The synergistic effects associated with the use of other CNS depressants like anesthetics, opioids, or alcohol can be helpful if they're anticipated and harnessed correctly. Versed has a quick onset, a low abuse potential, few drug interactions, and a large margin of error for overdose with a specific reversal agent. These properties have made it the single most commonly used drug for preoperative and intraoperative sedation. This is a list of the references that I used to make this presentation. Thanks for watching.